SEC presents Maintaining Business Continuity and Mitigating Risk During a Crisis. Before we get started, there's a small disclaimer. The content of this presentation is solely designed to provide awareness covering a variety of aspects related to business continuity and risk management in construction. Furthermore, this webinar does not qualify or authorize participants to perform, supervise, or train others in related training. This course is designed to provide a general overview and considerations for risk management and mitigation that can be considered to minimize business impact. Let's take a moment to see what we're going to cover today. We'll cover current construction impacts, challenges and impacts to safety business continuity, strategic considerations, practical considerations in 7 steps, best practices, and resources that you can reach out to. Let's take a moment to discuss some of the current construction impacts. Currently, 30% are experiencing delays or stoppage of work due to the current COVID-19 outbreak. 22% have experienced supplier delivery delays or even cancellations. 10% are experiencing increased absenteeism of the workforce. This can be caused by current city restrictions, potential exposures of the worker, or even potential exposure of a family member. Additionally, workers are having to stay out due to kids or younger family members being out of school and not having the correct care. There's also an unknown percentage that are experiencing a slowed production because of newly implemented site rules. These can include site questionnaires, lack of thermal monitoring equipment, or being held up due to a lack of a workforce. Lastly, there's been a growing percentage of workers' comp claims. A lot of these have to do with uncertainty and employees being worried about a paycheck, and then the employee seeing workers' compensation as a means to an end. Let's look at some of the challenges and impact to safety business continuity. On the challenge side, we have the exposure of infection. Workers don't want to get sick, and the disease might cause them to miss work. Unfortunately, this can also lead to worker distractions. Workers are anxious and they're fearful of the unknown, just like everybody else. Unfortunately, this can also lead to false injury claims. Workers fear losing their jobs, and so they might be tempted to utilize the system. Additionally, there's social distancing. Being 6 foot apart makes teamwork extremely tough. It can also make a learning environment be a little bit tougher to learn in. There's also PPE shortage all around the world right now. So if you're looking for N95 masks, latex gloves, and respirators, you might be out of luck. There's also the administrative burden that we're looking at, as well as shelter in place orders, and a shortage of sanitation stations and toilets. On the impacts to safety, there's our job stoppages and outbreaks. There's a higher potential for injury. Their injuries are more likely during this time where their minds are not focused. Additionally, because of the potential for injury, there are higher costs and injury rates. False claims can hurt OSHA rates, insurance rates, and production and employee morale. Also, with safety and regulatory changes, companies are stepping up to sell directly to the consumer. Then there's managing and implementing new requirements, policies, and paperwork that might cause challenges. Additionally, absenteeism will also be higher. Lastly, the spread of infectious disease or OSHA sanitation requirements might cause an impact simply because they'll be time consuming. Let's take a moment to look at some strategic considerations. First, we should review or execute a crisis management and business continuity strategy. From there, we'll be implementing a scalable, multi-phase emergency operations plan, as well as planning for a fluctuating workforce and limiting our exposure. strengths, weakness, opportunities, and threats, or SWOT analysis, with a risk register. Ultimately, the current threat is external and it's out of our control, but we can use a risk register to take all that we're afraid of and put it in order of importance. From there, we will keep risk management, cultural, and safety initiatives consistent. Lastly, task teams to monitor changing situations, such as your supers, whose job will be the restriction affecting construction, such as delays or suspensions. Your HSE, whose specific job site requirements and CDC changing guidelines and outbreaks. Then you have your PMs, who will be in charge of the impacts to the supply chain, so delays or cost increase. Legal, which are AHJ ordinances, such as shelter in place, additionally contract reviews or force majeure. Or lastly, HR, which are the employee impacts such as absenteeism due to quarantine or illness of a family member. Let's take a look at some practical solutions. There are 7 critical project protocol elements. Number 1, planning. Number 2, education. Number 3, communication. Number 4, preventative measures. Number 5, social distancing or people movement. Number 6, site cleaning protocol. And number 7, their fit for duty standard. Here's number 1, planning. Implement a company-wide preparedness and response written program. Build a site-specific preparedness and response plan to address each site in detail. This should include project organizational plan, and this will ensure that work crews are kept in separate areas on the project to maintain social distancing. Additionally, prepare coordinated site logistics, identifying the critical elements. And lastly, it'll outline requirements and organize all daily virtual planning and coordination meetings. Number 2, education. On-site infectious disease guidelines. Prior to allowing access to the site, consider having all participate in a site orientation performed virtually or within a safe distance. Post signage on infectious disease guidelines. These are going to be located in high traffic areas, so they could be included near a restroom, entrances to the building, or even break areas. Lastly, toolbox topics should be delivered, but they should also be delivered virtually or in small groups that are also maintaining proper social distancing. Number 3, communication. Part of your plan should include a reporting protocol when workers are diagnosed as carrying COVID-19 or suspected or confirmed as having been exposed to COVID-19. Provide a positive health message to the workers. And lastly, workforce management and processes to incorporate improvements to daily work planning and execution to reduce possible exposure risks. Number 4, preventative measures. All subs will be required to be responsible for their own employees. This includes social distancing, site cleaning, and even fit for duty, all of which will be discussed later. Require that all personnel acknowledge that they have not knowingly been in contact with anyone that is sick or traveled to an international high-risk area within the last 14 days, and then control delivery drivers. Number 5, people movement. Create separation plans to avoid congregation. People like to interact, which unfortunately is something that we're currently not able to do without social distancing. Daily safety planning. Discuss all of these items verbally, and then log all of these items on your daily reports. Cleaning protocols are to be established if tool sharing is needed. Additionally, personal tools will not be allowed in the gang boxes. Provide safe distance floor or ground markings where personnel congregates. These are areas like the restrooms, wash stations, lunch areas. Speaking of lunch areas, lunch gatherings need to be organized to maintain safe worker distances. Break up the lunch timings. Don't allow every group to go to lunch all at once in order to maintain the safe worker distance. Try to put multiple chairs between people if there's a chair location. If not, make sure that they are maintaining good social distancing. Lastly, plan daily in regards to crew safe spacing. Don't allow crews to work together. If at all possible, make sure that they're continuing social distancing while also staying away from other site contractors. Number 6, site cleaning protocol. Ensure that the site has adequate restroom and hand washing facilities. Outside of being an OSHA requirement, currently CDC is recommending that people wash their hands more than ever. The only way to do this is to ensure that we have adequate restroom and hand washing facilities. Signs in the break rooms and throughout the building telling people how to properly dispose of their food, beverages, and construction debris. Community equipment and tools will be checked out on a daily basis and cleaned at the end of the shift. Additionally, if it is community equipment and tools, it should also be cleaned every time that it changes hands. If two people need to utilize the item, the first person should clean it. The second person should also have a hand in cleaning it. All personnel must utilize their own dedicated PPE. Shared or community PPE will not be allowed at this time. Lastly, establish cleaning protocols and schedules in high contact workspaces. And finally, number 7, fit for duty. It is recommended that individuals who feel like they are high risk, as defined by the CDC, not work on site at the project. So, any person with a fever or obviously a positive COVID 19 diagnosis will not be allowed to enter the site until they are free of fever for at least 24 hours without the use of fever reducing medication. Any person that has had close contact with a confirmed COVID 19 patient, with close contact being defined as being within 2 meters 6 foot of a person with a confirmed case of COVID 19 for a prolonged period of time, will not be allowed to enter the site for 14 days starting from the day they last interacted with the person with COVID 19. All personnel requesting access must be compliant with any applicable quarantine requirements for travelers returning from international locations. So, once again, let's take a look at some of the best practices. Institute a site specific safety and logistics plan for infectious disease. Additionally, employee training should occur on that policy and the site specific plan. Job site postings to educate in common areas. These include lunch areas, restrooms, or hand washing stations. Small group huddles of less than 10, social distancing, and outside meetings. These are the only way that people should be meeting, with an emphasis on social distancing. Social distancing of greater than 6 foot with enforcement and monitoring to make sure that the social distancing is happening at all times. Identify ACP for tasks that might be impeded by social distancing and mitigation. Virtual meetings should occur for planning and coordination. Electronic paperwork submittals to clients and or customers. There should be a regular cleaning of high-touch surfaces, such as doors, handrails, brake areas, transport vehicles. Cleaning protocols are to be established if tool sharing is needed. Consider including delivery drivers and vendors into the site specific protocol. Lastly, leverage professional partners. Lastly, leverage professional partnerships. There are several partnerships that you can potentially leverage, such as the American Subcontractor Association, STC, your insurance company, trade partner organizations, Texas Construction Association, or even TEXO. Here are some resources that you can utilize to stay ahead of COVID 19. There's STC, who can provide emergency operations planning, an infectious disease program, internal memos to associates, external memos to your vendors, business essential letters, toolbox talks, and can even help out with job site posters. Additionally, there's Johns Hopkins University, who has an interactive map for the coronavirus outbreak, as well as resources to help stay ahead. There's also OSHA, who has guidance for the novel coronavirus. Additionally, there is the Center for Disease Control and Prevention, who has given out all of the outlines needed in order to maintain a safe and healthful work environment. And lastly, there's NIOSH,